Hi, my name is Amanda. I'm a nurse on the medical unit at FMH. And what I'd like you to know about what's going on in the hospital with COVID and the Delta variant doesn't have to do with numbers or statistics or probabilities. What I want you to know is about the human experience of dying from COVID-19. I've had the honor of working on 2 South and caring for dying patients for the last 12 years, and our team is really good at it. We know what interventions to put in place to alleviate suffering, and we know what medications to use to help control symptoms at the end of life. COVID-19 patients are different. Even before end-of-life care, we are using morphine to alleviate a symptom we call air hunger. This is a severe state of breathlessness. It's very distressing and it's very common. It's very significant with COVID-19 patients. COVID-19 patients that die transition from being okay to actively dying very suddenly and often without warning. They start to experience a state of panic and air hunger that is very difficult to manage and causes severe anxiety. The medications that we usually use for patients at the end of life don't help as much with COVID-19 patients when they're dying. And so what we're seeing are deaths that are not only isolated, but they're also very traumatic. The family that's left behind are layered with feelings of anger and sadness and guilt and regret. We've had to bring little kids up to say goodbye to a dying parent. We've had spouses who are sick together in the same hospital room, and they've had to say their last goodbyes to each other as one of them discharges home to get better and the other doesn't make it out of the hospital. What I want you to know about what's going on in the hospital with COVID-19 is this is not an experience that you want for anyone that you love. Thank you for listening.